Ever sat through a lecture on cooperative learning strategies and thought, I know this matters, but what does it actually look like in practice? You're not alone. The term sounds simple, but putting it to work in nursing education can feel fuzzy. Let's fix that. In the next few minutes, we'll break down cooperative learning strategies in plain language, show you the key methods, and connect them straight to the clinical world you already know. Cooperative learning is a teaching approach where students work together in small groups toward a shared goal. Instead of learning alone, they learn with and from each other. But here's the important part. It's not just group work. Real cooperative learning has structure. Every student has a role. Everyone stays accountable. And the group only succeeds when each member contributes. Think of it like a well-run nursing unit. When the whole team pulls together, patient care improves. When one person checks out, the whole team feels it. That same principle drives cooperative learning. Let's look at 3 methods you can actually use. First, think, pair, share. This one is simple and powerful. You pose a question. Students think on their own first, then they pair up to discuss. Finally, they share with the larger group. Picture a question about prioritizing care for a patient with low oxygen saturation. Students reason it out solo, compare their thinking with a partner, then explain it to the class. They learn the content and practice defending their clinical decisions. Second, the jigsaw method. Here, you break a big topic into smaller pieces. Each student becomes the expert on one piece, then teaches it to their group. Say you're covering the stages of wound healing. One student masters inflammation, another the proliferative phase, another maturation. When they come together, they build the full picture as a team. Teaching a topic is one of the best ways to truly learn it. Third, team-based learning. This method uses structured teams that stay together over time. Students prepare in advance, take a readiness check, then apply their knowledge to real clinical scenarios as a group. Imagine assigning a complex case involving a patient in heart failure. Teams work through assessment, prioritization, and interventions together, just like they will on the floor. So why does this approach fit nursing so well? Nursing is a team profession. You collaborate with providers, techs, therapists, and fellow nurses every single shift. Cooperative learning builds those teamwork muscles early. It also strengthens critical thinking. When students explain their reasoning out loud, they catch gaps in their own understanding. They learn to ask questions, challenge ideas, and think on their feet. And it boosts retention. Active social learning sticks far better than passive listening. That means stronger performance on exams like the NCLEX and more confidence in clinicals. Here's how these strategies carry into practice. 1. Shift handoffs. The same clear communication students practice in group discussion shows up in accurate, confident reports. 2. Rapid response situations. Team-based learning mirrors how you'll divide roles and act fast during an emergency. 3. Patient education. Explaining concepts to a group, like in Jigsaw, sharpens your ability to teach patients and families in ways they understand. 4. Interprofessional rounds. Cooperative habits help you contribute your voice and value others' input. The skills your students build in the classroom become the skills that keep patients safe at the bedside. A quick tip for educators. Keep groups small, usually 3 to 5 students. Give every member a clear role, and always connect the activity back to a real clinical outcome. That's what turns a fun exercise into meaningful learning. Cooperative learning strategies help you build confident, capable nurses ready for real teamwork. And the learning never has to stop. Ready to take your knowledge further? Visit elitelearning.com for trusted continuing education and resources designed to support your growth every step of the way. Learn at your own pace, anytime, anywhere at elitelearning.com.